Fred Bush, what do you see the district's role in attracting healthcare services to the community?
Well, certainly the district can play a role in attracting healthcare professionals into the community. It can do any one of a number of things. It can provide some subsidies to attract people. It can provide some housing, rent-free, partially rent-free for people to come here. It can also, I guess if we wanted to go that way, we could even provide some tax relief for property that the medical facility owns. So there certainly are lots of ways in which we can act.
Thank you. Gord Bushel, what do you see the district's role in attracting health services to the community?
I think that what we need to do is get involved with our senior center and senior activity center. And we had a conference last night that Palm Beach put on, and we all learned a lot from that conference. And what we need to do is get involved and see if we can find a physician to replace our retiring Jack Beach, which is going to retire in 3 to 5 years. So I think there's lots of things the district could do by financially going out and having some kind of incentive for a doctor to move here, and like Fred said, residents. And we have to get involved. All the other communities in the world are doing it. And if we don't do it, we're going to be sitting here in 4 or 5 years without a doctor, and that's going to be disastrous for Sycamores. So I really think that we, as a district, we need to get involved in finding a physician and to help out our seniors care facilities here in Sycamores. Thank you.
Thank you. Jeff.
Well, the two predecessors have championed exactly what was talked about last night by Palm Beach. The only thing that I could add to it is that we have to go to the colleges to find young, just out of university, completed, accredited doctors. And we need to start looking in January. If we don't start looking in January, all other communities are already on the bandwagon to do that. We used to be able to import doctors from South Africa, and that's been brought to an end. So it's paramount, if you want to have a family here and kids, that we have a medical doctor. Thank you.
Don Richardson.
As I stated before, I'm an infrastructure person, and I realize and well aware now that the medical situation is part of our essential infrastructure. In that, we need to create more dialogue with Interior Health and the BC physicians and surgeons, and this has been reflected with the last speakers, is to create some kind of incentive in the internship of the BC physicians and surgeons that makes it more beneficial for these younger doctors or nurses to want to do some of their time in rural settings. So those are things we need to discuss with those other levels of medical governance to help bring about those kind of positions into our community. It's very paramount, as has been said, that we have those facilities here. We're all aging.
That's excellent. Okay.